In previous video, we discussed about visual phototransduction cascade and light-dark adaptation of eye. Today we will discuss about image forming mechanisms of eye and its common defects. To understand the image forming mechanisms of eye, we must first understand the principles of optics. So first, most important principle one must understand is that the light rays are bent when they pass from a medium of one density into a medium of a different density, except when they strike perpendicular to the surface. This bending of light rays is called refraction. This mechanism allows one to focus an accurate image onto the retina. The parallel light rays striking a biconcave lens are refracted to a point behind the lens. This is called principal focus. The principal focus is on a line passing through the centers of curvature of the lens. This line is called principal axis. Now, the distance beyond a convex lens at which parallel rays converge to a common focal point is called as focal length of the lens. Another important principle is that a biconcave lens diverges the light rays, whereas the biconvex lens converges them, as shown in the image below. Next principle is that the refractive power of lens increases as its curvature increases, as shown in the image below. The refractive power of any lens is measured in diopters. Now, calculation of diopters is very easy if one knows the focal length of the lens. We already discussed that focal length is the distance at which a lens focuses parallel rays of light. So, if a lens focuses light at a distance of 0.25 meters, then its focal length will be 0.25 meters. Now, number of diopters is just reciprocal of focal length of lens in meters. For example, a lens with a focal length of 0.25 meters has a refractive power of 4 diopters. Human eye has a refractive power of approximately 60 diopters at rest. Now, the image which falls on retina is inverted and reversed with respect to the object. To understand this concept, just imagine a biconvex lens focusing an object and a white sheet of paper is placed at the focus distance from the lens. Now, one can see an image of the object as shown in the image below. However, this image is upside down with respect to the original object, and the two lateral sides of the image are reversed. The lens of a camera focuses images on film via this method. Our eye works on the same principle, and hence the image which falls on retina after passing through the lens, it is inverted and reversed with respect to the object. However, the mind perceives object in the upright position despite the upside down orientation on the retina, because the brain is trained to consider an inverted image as normal. With above discussion in mind, now we all know how the lens of the eye focuses an image on the retina. But the things are not so simple. In our day-to-day life, we frequently shift our focus on different objects. Some of them are close to us and some of them they are far. But then also we see each and every object very, very clearly. In this modern era, most of the people are having the smartphones with powerful cameras. We all know while taking the photographs, if we suddenly change the camera focus from one object to another object, the image will be blurred for a fraction of a second until the camera autofocuses on new object. But this does not happen in normal life. This is because the nature has incorporated a very powerful autofocus mechanism in our eyes. This mechanism is known as accommodation. The accommodation is so fast that we don't even have the feeling of image getting blurred if we shift our focus from near object to far object and vice versa. So now let's discuss about accommodation. So accommodation is the process by which the vertebrate eye changes optical power to maintain a clear image or focus on an object as its distance varies. In simple words, we can say that accommodation is the process by which the curvature of the lens is increased. Now, the maximum distance from the eyes for which a clear image of an object can be seen is known as far point, and the closest point from the eyes at which an object can be placed and still form a focused or clear image on retina is called near point. For a rough idea about near point, just close one eye and hold a pen in front and focus at its tip and slowly try to move it closer to your eye. As you move it closer and closer, a point will come where the tip starts getting blurred. So the point immediately before the tip starts to blur is the near point for you. Remember, this is not the actual standard test to determine the near point. I am telling this so that you can just get an idea about what happens when the near point is reached and when you cross it. We will discuss about testing the vision later on in another video. So there are three possible ways for accommodation to accurately focus an image on retina. First is by moving the retina towards or away from the lens. This is not possible in humans, but this mechanism is present in some mollusks. Then another option is by moving the lens towards or away from the retina. This option is used in the modern autofocus cameras, where the lens moves inwards and outwards to maintain good focus. This mechanism also exists in some fishes, but unfortunately, this is also not possible in human beings. Then last option is by altering the convexity of lens, and this mechanism is present in our eyes. The young human eye can change focus from distance of infinity to as near as 6.5 cm from the eye. This dramatic change in focal power of the eye of approximately 14 diopters occurs by the process of accommodation. And this process can occur in as little as approximately 224 milliseconds in the bright light. In simple words, we can say that our lens can change its refractory power by approximately 15 diopters by altering its convexity by means of accommodation process. Another important point to remember is that the amplitude of this accommodation decreases with age, as the lens loses its flexibility due to aging, and thereby its capacity to alter its refractory power will decrease from 14 diopters to as low as 0 diopters. And this leads to a condition called presbyopia. Now, accommodation, it is controlled by parasympathetic nerves, and it usually acts like a reflex, but can also be controlled consciously. Now, let's briefly discuss how the convexity of lens is altered. At rest, the lens is held under tension by the lens ligaments. Because the lens substance is malleable and the lens capsule has considerable elasticity, the lens is pulled into a flattened shape. Now, if the gaze is directed at the near object, the ciliary muscle contracts. This decreases the distance between the edges of the ciliary body and relaxes the lens ligaments so that the lens springs into a more convex shape. This change is greatest in the anterior surface of the lens. In young individuals, the change in shape may add as many as 14 to 15 diopters to the refractory power of the eye. The relaxation of the lens ligaments produced by contraction of ciliary muscle is due partly to the sphincter-like action of the circular muscle fibers in the ciliary body and partly to the contraction of longitudinal muscle fibers that attach anteriorly near the corneoscleral junction. As these fibers contract, they pull the whole ciliary body forwards and inwards. This motion brings the edges of ciliary body closer together. Now let's discuss about accommodation reflex. When a person looks at near object after seeing a far object or vice versa, three adjustments are made in the eyeballs. They are convergence of eyeballs, constriction of pupils, and increase in convexity of lens. You can remember this with 3 C's. This last point, that is increase in convexity of the lens, we already discussed in accommodation. So accommodation reflex is indeed lens accommodation response together with convergence of eyeball and pupillary constriction. And all these 3 responses occur when the individual looks at the near object, and hence also known as near response. And when the person shifts his gaze from near object to far object, opposite set of events occur and is known as far response. Now let's come to pupillary reflex. So pupillary reflex is one of the reflexes associated with pupillary function. These include the pupillary light reflex and accommodation reflex. Accommodation reflex we already discussed. So now coming to pupillary light reflex. It is a reflex that controls the diameter of the pupil in response to the intensity of light that falls on the retinal ganglion cells in the back of the eye, thereby assisting in adaptation of vision to various levels of lightness or darkness. A greater intensity of light causes the pupil to constrict, which is also known as miosis, whereas a lower intensity of light causes the pupil to dilate, which is also known as mydriasis. The pupil of human eye can become as small as about 1.5 millimeter and as large as 8 millimeter in diameter. Now you might be thinking why I am discussing about pupillary reflex in this topic of image forming mechanisms. This is because the depth of focus and the amount of light which is entering the eye can be controlled by altering the pupillary diameter. So depth of focus of the lens system increases with decreasing pupillary diameter, as shown in the image on the right side. In this video, we have briefly discussed about accommodation and pupillary reflex, but in my upcoming videos, I will discuss them in more detail. Now finally, let's come to errors of refraction. So refractory error is a problem with focusing light accurately on the retina due to the shape of the eye. They can be corrected with eyeglasses, contact lenses, or by surgery. An eye with no refractory error when viewing the distant object is said to have emmetropia, whereas an eye that has refractive error when viewing distant objects is said to have ametropia. Now, refractive errors can be classified into spherical errors and cylindrical errors. Spherical errors, they occur when the optical power of the eye is either too large or too small to focus the light on the retina. They can be corrected by convex, concave or bifocal lenses. Whereas cylindrical errors, they occur when the optical power of the eye is too powerful or too weak across one meridian, such as if the corneal curvature tends towards a cylindrical shape. Spherical errors include myopia, hyperopia, and presbyopia, whereas cylindrical errors include astigmatism. Apart from these, there are some other conditions like anisometropia, amblyopia, and aniseikonia. So, myopia or nearsightedness, it occurs if the optics are too powerful for the length of the eyeball. This can arise from a cornea or crystalline lens with too much curvature. In this case, we call it refractive myopia. Or if it may arise from an eyeball that is too long, we call it axial myopia. It can be corrected with concave lens. Now come to hyperopia or farsightedness. It occurs if the optics are too weak for the length of the eyeball. This can arise from a cornea or crystalline lens with not enough curvature. We call it refractive hyperopia. Or it may arise from an eyeball that is too short. We call it axial hyperopia. It can be corrected with convex lens. Now coming to presbyopia, it occurs when the flexibility of the lens declines, typically due to the age. Here the individual would experience difficulty in near vision. It can be corrected by reading glasses, bifocal or progressive lenses. Now coming to astigmatism, it is a common condition in which the curvature of the cornea is not uniform. When the curvature in one meridian is different from that in the others, the light rays in that meridian, they are refracted to the different focus, so that the part of the retinal image is blurred. It can be corrected with cylindrical lenses. Now in anisometropia, the two eyes have unequal refractive power, whereas in amblyopia, the brain fails to fully process the input from one eye, and over the time, it favors the other eye. This results in decreased vision in an eye that typically appears normal in other respects. This condition is also known as lazy eye. Finally, in aniseikonia, there is a significant difference in the perceived size of image. So that's all for today. In next video, we will discuss about visual pathway. So keep watching. Thank you. Have a nice day.